Hi everyone, welcome to Bioethics for Beginners, the first bioethics lecture in the SIN B1 series. And we're going to be looking at, in this lecture in particular, we're going to be looking at bioethics in kind of its most basic form. I'll talk a little bit more about that in a second, but this will be the first set of a few lectures on bioethics and human practices, the first two of which will be from me, Este, and the second two, which will be from Umar. So throughout this lecture, we're going to be basically looking at what is bioethics. We're going to start with some definitions and the role of bioethics in the world. We're going to look at environmental examples and how the environment intersects with ethics and bioethics. And we're also going to look at ethics and ethics versus science and how some questions may be looked differently by those in different fields. And then we're also going to be looking at how to identify facts in a situation or a particular case, because identifying facts is a huge part of bioethical reasoning and thinking. And then finally, we're going to kind of set ourselves up for success for the next lecture. So we're going to be talking about practicing bioethics, and some of that will look at harms and benefits and kind of the different ways you can weigh harms and benefits and how they affect different stakeholders. And we're also going to look at identifying stakeholders and what they are, who they are, why they are important, and why they are so important for bioethics specifically. So the first question that we'll ask is, what is bioethics? Seems like a simple enough question. Whether you're new to bioethics or if you've been studying it before, if you've just learned about it from COVID, you know something about it, maybe take a moment to think about. You could pause the video, you can just take 5 seconds and think about what words might come or images might come to mind when you see the term bioethics or you hear about bioethics. For me and for a lot of people, you might hear some terms like justice, healthcare, medicine, ethics, genetics, biology, everything like that. Everything to do with that. Those are just some words that come to mind for me. They might be different for you. So when we're thinking about bioethics, we're kind of talking about a combination between ethics and life science. So we really have to make sure we have an understanding of what ethics is if we want to understand, of course, bioethics. So when we think about ethics, we're thinking about deciding what one should do, deciding what the best course of action is going to be in a given situation, and you're providing reasons and justifications for that course of action, and you're suggesting how people should treat others, whether they be other people or beings. Backspace. Provides reasons and justifications for that course of action, and it also suggests how people should treat others. Now we kind of have to discuss this interesting question, which is the scientific question versus a bioethical question. And we won't get too deep into this, but it's just an interesting distinction to make that I think would be important. We're kind of asking, what is the difference between the two? And you may already know this, bear with me if you do. We'll just do a quick, it's just really to help you understand the difference between questions that you're asking when you're asking scientific questions and questions that we're asking when we're asking bioethical questions. So a scientific question is, of course, going to ask what the world is. So, you know, what is something in the world, backspace. Scientific questions are going to ask what the world is, whereas ethicists are going to ask what we should do. So we'll talk a little bit more about this, but we're kind of the key distinction there is focusing on what is versus what we should do, what action we should take. What does a bioethicist do? Well, you really want to start with figuring out the ethical questions that you're dealing with. So if you have a problem, say, or something that is going to be done. So let's say that this is someone, they want to change the healthcare service, a certain healthcare service in a hospital. Well, that's going to affect people for sure. It's going to affect different patients. It's probably going to affect doctors. So you need to figure out first, what are the ethical questions that are being asked? What problems are arising? What potential problems are arising? And what course of action is the best to take if there are options that are conflicting, for example, or needs that are conflicting. So you really want to weigh the pros and cons of any given situation, of any course of action that you're going to take. And so that's really something that is important in kind of what a bioethicist does, and just really considering all the possible courses of actions and issues that might come up. And you're also, of course, going to identify the stakeholders, and this is something that we will be coming back to. It is very important, and stakeholders just being the people or things, we'll come back to this, so just briefly, it's just the people or things that are affected by what you are doing, by what is happening. And so you need to consider all those needs and risks, and then of course you need to be able to identify any unseen or complex problems that might arise. So you've got to be considering, is what you're doing worth the risk? Is the path that we're going to take worth a risk, or is it really going to produce this benefit? Can you prevent the problem you're trying to prevent? Will you prevent the problem by what you're doing? So it's all these different little things that you're really considering when you're thinking about an issue or a particular issue. Where does a bioethicist work? That would be a great question. Well, often in hospitals as consultants when certain ethical issues come up, anything from doctors can go consult them to patients, also as policy advisors and health and governmental advisors, on advisory and ethics boards and ethics committees, in pharmaceutical companies and startups, especially recently. Bioethicists can find work in a lot of different areas and a lot of different places. Often the streams are kind of, you go either clinical, or not often, but you can go clinical, you could go in a pharmaceutical route, you could go policy, you can do really a whole lot and have a really well-rounded career. So what makes a question ethical is an important thing to consider, because bioethicists need to know how to identify questions in a particular case, and they certainly need to be able to know which questions they're identifying are ethical. And what I mean by is the question ethical, I'm asking not is it right or wrong, but is it asking something of us, suggesting that there is a better or worse answer. So for example, when you see an ethical question, you're going to look for words like ought or should. Ethical questions ask, what should we do, or what we ought to do in certain situations. They discuss phrases. They have phrases that discuss a course of action with different possible outcomes. There's also going to be a moral dilemma where underlying individual values clash. So you may have multiple separate identified people or groups or things that have different values and needs, and those values are at odds. And there's no right or wrong answer, only better or worse answers. So we'll do just a little bit of an example just to kind of make it clear of what is an ethical question. So I'd like to do a few examples just to kind of hit home really what is an ethical question. I don't know if it'll work, but we'll see. We'll see if it works online, I guess. So the first question, should I bring my umbrella today? Do you think that is an ethical question? Take a second to think about it and come back. No, it is not an ethical question, and that would be because it's really just Should I bring my umbrella today? Is it raining outside? Yes or no? Is it sunny outside? Yes or no? It's really more of a fact-based question, or it doesn't ask something like there's no moral dilemma, or there aren't any values clashing like we discussed before. Can I go to the bathroom? Think about this one and come back. So this one also would not be ethical. In most ways we understand the question, can I go to the bathroom? It's pretty basic, straightforward. There's no big dilemma. It's just, can I go to the bathroom? Yes or no. It's not a big moral dilemma at all. Should I lie to my child? That's a little bit of an interesting one. So I would call this ethical, and I'd say that because it has the marker there, which is a clue, should. That's not 100% though. Then there's a moral dilemma. We generally consider lying to be a little morally fraught, at least in our society. So that is kind of a moral dilemma of, should I lie to my child? And there are options of yes or no options that could lead to different bad or good outcomes. Next we have, should we test this drug? And this is a interesting one again. Again, this one may be a little bit more context dependent, but I would still say, as we understand it, generally more an ethical question if we're thinking about it in terms of, testing a new drug. Of course, there's lots of cases like that, and bioethicists, I tend to speak fast in case you didn't notice. And bioethicist are definitely needed in the pharmaceutical industry. So yeah, I would say ethical question. And should I have children? This one I would say is also context dependent, but ethical in many ways. People might often ask as a moral dilemma, should I have children? It is often one considered now, especially during times like these. So again, it is something that could be considered an ethical question. Thank you for indulging my, game. And we'll move on to some important considerations in bioethics. Now, this list will by no means touch on everything, of course, but it is important to consider these things, and I think it's a good start for beginners. It's especially a good start for beginners in kind of accelerated courses. So definitely important consideration, maximizing benefits and minimizing harms. That is something very important. We will be talking about it more, but whenever you are considering a course of action, you want to be considering what will maximize benefits and minimize harms. Then we have the promotion of autonomy. We really want to always be ensuring that we are doing the most we can to ensure that the autonomy of beings that have autonomy is respected. And next we have consent. We always want to be ensuring that consent is obtained and consent is considered. And then we want to always be identifying and examining the facts of any situation. So before you start any kind of analysis, you want to make sure that you know what facts are in the case and what facts you will be considering in order to come to certain conclusions. And then, of course, we would want to consider environmental ethics and biodiversity. We will talk a little bit about that here just to get kind of an idea of it. And then fair and considerate policymaking, which of course affects everyone in the society that you live in, and is something incredibly important, which will be touched on later on, mainly by Umar. It is incredibly important to understand what a benefit is when you are learning about bioethics, because benefits are essential to knowing if you're ending up in a good situation when you're considering a case or an issue or anything. So it's so important to understand what benefits do and what they are. So benefits promote health and they promote biodiversity. Biodiversity, of course, meaning like an improved ecology, an improved ecosystem, health for animals, wellness for animals, everything like that. Benefits have psychological improvements. It could be a psychological improvement, whether mental illness is improved or something like that. And it could limit the spread of disease. So if you have a good policy systems in place and good PPE reservoirs, good testing, everything for something such as a pandemic, that would be a benefit, would be limiting the spread of disease, hopefully. And then you have relief of suffering, of course, and improving general quality of life overall, just making someone's life better. And then a benefit may be achieved by adding or removing the influencing factor. So that basically means that a benefit could mean that you add something to someone's life or to a situation, or you take something away. So if you add something, it's a positive, and if you're taking it away, it would be a negative. So if you give someone antidepressants and it cures their depression, then you've added something that cured their depression. If you remove someone from a bad situation and that improves their psychological health, then you have taken something away, or you've removed someone from a situation, and that would be a negative, but it would still be a benefit to them. And of course, anytime you're talking about a benefit, you want to be talking about the harms too, and harms versus benefits. I won't give all, a whole bunch of examples because there's tons, you could go on forever, and they're similar, and so it would get repetitive. But examples of harm could be that something limits your autonomy, or that increases suffering and pain, or a harm may limit your resources and increase your mental suffering. There are lots of examples, and I'm sure you can think of a lot. You could take some down of things that are harms or benefits. And harms, like benefits, can add or take away something. So you may add something to someone's life that may limit their autonomy or cause them pain, or you may take away something from someone's life that may then in turn cause them pain. So if you take away resources from them, then you're taking away something, and that would result in a harm to them. And of course, the ultimate goal of considering these harms and benefits is to maximize the benefits and minimize the harm. So really in bioethics, that's what we're trying to do. We really want to make sure we're trying to get the best and most substantial benefit out of a situation, while also hopefully having the least amount of harm done. And it's up to the ethicist to weigh these harms and benefits and decide which outcomes, and decide which comes out as the better course of action. So ultimately, what will be the better option in order after weighing these harms and benefits? So what will be the best course of action for us? Figuring out the facts is incredibly important as a bioethicist, because you need to know what is going on, even those basic facts of a situation, what is going on, in order to properly assess a situation, to properly understand the big issues at hand. So first thing you want to do is consider what are the specifics of the case or situation. For example, if you're in an emergency room that's trying to fix its triage system, and because they have some issues in the triage system, well, you want to take down what is the current triage system, who is in charge of it, who uses the system, like all these different things, who uses the emergency room, all these different facts that may seem important to the case later on. You want to understand those, you want to know what those are, and just have that information available to you. And then you want to see how these specific facts affect stakeholders. And again, stakeholders being those things, people, beings that are affected by a particular course of action or inaction. And you want to be really seeing how specific facts affect different people. And then you want to think about, well, what would change in this situation if some of the key facts were different? And this is important because sometimes when you are looking at a particular case, you can really get stuck in what you see as unchangeable facts, but you want to change your perspective a bit. So you want to change a couple of facts here and there, maybe get a different sense for how the situation might look if things were different. So if you implemented a certain change, or if this particular barrier was not in place, how might your issue look then? And then finally, you want to know what is unknown. You want to be aware of any blind spots, and you want to just have that, even if you don't necessarily know exactly what you're missing, but you want to be aware of, okay, well, you don't know exactly how many people are part of this group or blah, blah, blah. You know, something like that. You want to have a list of your unknowns because those are important. Those unknowns are important because they can drastically affect outcomes if you are off in data, or if you are not prepared for that kind of unknown factor. You could be surprised by adverse outcome. So now that we understand a little bit about how to figure out facts, I really want you to put that into action. So for this example, all I want you to do is just pause this video, read it through, and using the cues that we just talked about in the previous slide, determine all of the relevant facts that are in this example. So all of the relevant facts that the example mentions that may be useful later on when determining other things. So just pause the video, figure that out, take a few minutes, and we'll come back to it on the next slide. There are a number of things that you could have written down. These are some that I would expect people to have noted for some of the facts of the case. So treatment for severe anxiety, that the medication was to treat severe anxiety and depression, and that it is administered through a shot monthly, and that patients can be trained to give the shot to themselves, and it is intended to replace the use of other SSRIs, so pills and things like that, and it is stronger. It has a stronger potential for side effects. So remember that they said that there was a stronger potential for side effects, and that there were a couple new side effects as well, and that it works 10% better in some of the patients. And finally, that it is cheaper than most other options. Oh, and one thing that I didn't write down, but good to note, that it was intended to be used in conjunction with therapy or on its own, but as stated before, intended to replace the use of other SSRIs. So autonomy is a very important concept that I want to go over here. Essentially, when we talk about autonomy, we talk about the idea that people have the right to make their own decisions and should have the opportunity to make their own decisions about things that have to do with themselves. When we think about ourselves, we want to be able to be in charge of our own lives. We want to be able to take charge of the things that affect us as much as possible. So where possible, especially when it comes to health, especially when it comes to wellness, autonomy is incredibly important, because autonomy is important for not only your physical well-being, but your psychological well-being. Without the feeling that you have autonomy, you're certainly going to have a lot more of a struggle feeling well on the inside, I would say. So it's an incredibly important concept to understand, especially as it gets more tricky, because you can't always respect autonomy. We have to do our best, but we certainly can't always respect it, and that's real, and it's not always the most important thing, but it is often an incredibly important aspect, especially for the self. So there are a few different aspects of autonomy that we should discuss. The first one or two would be freedom from interference in decision making and freedom from coercion. So these kind of go together a little bit. Essentially, it's what it sounds like. When you are making a decision, you should be able to make that decision without influence from other people, without people putting in their opinions, bias, without coercion, being bribed, without being threatened, without any kind of interference that, essentially would be trying to change your mind. But yeah, people can change your mind. People can make suggestions. Certainly, I may be an adult, but my mom may want to make a suggestion about, my health choices. But it doesn't mean when we talk about autonomy that people can't make suggestions. What it means is that people should be free from coercion and should be free from undue interference in decision making. And then we have right to self-determination. So right to self-determination is an important one as well, because it essentially talks about our desire to make our own life story, to figure out the choices that we want to make in order to give ourselves a good life. Without the ability to control your own life, you're not going to have any autonomy at all, because you have no say in what's going on. So you need to give people the feeling that they have the right to self-determination, as well as, in actuality, their right to self-determination, because people do have that right. And we want to ensure that we are respecting the individual's path and the individual's choice for their life path, because it is not yours to make decisions about necessarily. And then we have right to information about oneself. So this one is especially important, and it also is a little bit relevant to consent, which we'll discuss in a bit. But the right to information about oneself, well, you need to have information about yourself if you're going to make decisions about anything to do with yourself. If you want to make decisions about your health, your personal finances, your well-being, you need to have your medical, financial, your personal information available to you unaltered, in a way that you can understand it, so you can make proper decisions. Otherwise, you won't be able to make effective decisions, and you won't because you won't have all the proper information. And then, of course, we talk about decisional capacity. So this is an important aspect, because autonomy can't always be respected. And we'll actually do communicative capacity together with it, because they kind of run in a similar vein, in that autonomy, when you have autonomy, you need to be able to make clear and reasonable choices about yourself. So you need to be able to make decisions that are deemed by whatever standards are being used. These standards may change based on the city or the country or the organization with which you're in, but you need to have demonstrated and demonstrate the ability to make current, clear, and reasonable choices about yourself. So responsible decision making, safe decision making, things like that, that needs to be something that is demonstrated. And then with communicative capacity, it's pretty similar. You need to be able to communicate your wants and needs and your desire and your choices. You need to be able, it doesn't have to be speaking, of course, because lots of people and beings can't speak, but people can and animals can communicate other ways, and there needs to be some level of effort made both on the communicative side and on the side of the person who's understanding the information. They need to make the effort to really understand what you're trying to say. So don't just assume decisions for someone, but you do have to have that communicative capacity. If you can't communicate your needs and your wants, then there's just no way that people can understand what your decision, what your wants and needs are. As I was talking about a little bit a moment ago, there are reasons that we may not be able to respect autonomy. These are important to consider. So anytime you're thinking about a particular case or about a research project or scenario, there may be reasons that even though you want to respect the autonomy of the stakeholder in that situation, you may not be able to do it to the best degree, to the degree that would be ideal. But these are a couple of reasons why autonomy may be limited, but they definitely aren't all of them, and is more just to give, an idea. So mental capacity and inability to communicate, kind of like we talked about before, you need to have some mental capacity, or sorry, let me rephrase that. You don't need to. Mental capacity is an important aspect in understanding autonomy because it may influence one's ability to make certain decisions. So it might not 100% do that, but in certain scenarios, it certainly may influence one's ability to make decisions about their health, about their well-being, and everything like that. And the inability to communicate is similar. If you cannot communicate your wants and needs, like we talked about before, then there's no reasonable way that someone could understand or comprehend what you need and what you do want aside from objective standards. So those are two reasons why autonomy may be limited. And then we have the inability to demonstrate safe and competent decision making. So we did talk a little bit about this on the previous slide, but again, just to reiterate, if you can't demonstrate safe and competent decision making, then you won't be able to make those decisions depending on the standards of the situation that you are in. So for example, if you have an eating disorder and you are in inpatient care and the doctors and nurses, are trying to get you to eat, and you do not want to have your meals watched, because often when you're in inpatient care, they will watch you eat. But unfortunately, even though that is a breach of your autonomy as an individual, often, not always, in situations like that, it would be a reason to limit autonomy in order to watch the meals, because the doctors could feel that you have not demonstrated safe decision making and competent decision making before in terms of food, so they would potentially reason that it would be best to limit your autonomy, especially in a situation with an eating disorder. And finally, we have age. Age is definitely something where autonomy is often limited. Children just don't have the same ability to make decisions in a lot of cases. They, not ability necessarily, but rights, or children of a certain age, it kind of plays into all of these different aspects: mental capacity, and inability to communicate, and inability to demonstrate safe and competent decision making. Your age can play a factor. You may be a very mature person, but often age is a reason for the limitation of autonomy in conjunction with a lot of other factors, because age often means that you have a slightly limited mental capacity than perhaps a full-grown adult. So consent is definitely an important topic here, because you need to have consent in order to do so many things, and people often mistake what consent really means. And especially in bioethics, we need to be considering consent in so many aspects, whether it be in a drug trial, whether it be in a hospital, or about land, everything like that. Consent is important. So we won't get into everything here, but we're going to get into, one or two important points about consent for our purposes. And I think that would be in stuff that's more related to immediate healthcare items, such as health procedures, research studies, drug trials. These are things that we're going to be more concerned with, especially as it relates to synthetic biology. One thing we want to be clear on is that the patient or participant gives clear and informed consent to whatever they are participating in or experiencing. And clear and informed consent means something very specific, because it means that you have given them the information they need in a way that they understand in order to make the appropriate decision or to give consent, because you cannot give consent if there is not the proper information given clearly. And this is across pretty much everywhere. People should know this, that let's say, for example, you ask to borrow my coat, and I say sure, but you don't tell me that you're going to be painting your bedroom in it. and I really like this coat, and I would not have agreed to lend you the coat if you didn't tell me, or if you had told me that you were going to be painting your bedroom in it, because I want to keep it clean. So obviously this is a case where information was either withheld or was just forgotten about, and that consent would not be valid because there was not enough information given. And the outcome, if had that information been given, the outcome would have been different. This is something, and especially important, like I said, in regards to health procedures, research studies, drug trials. There are lots of other ways that we might consider consent, but this is a particular one that I would want you to think about, especially when considering a case, or how much, any case that we're going to be talking about, how much are you going to have to consider consent? Who is involved? What is potentially being affected here? What do they have to give consent to? What information needs to be given, and how does the information need to be given? So just some food for thought for yourself. We're not going to go over it here, but what are some ways that you might achieve informed consent when conducting a new drug trial? So think of some examples yourself. What are ways that you might want to express to people certain information when conducting a particular drug trial, so that you ensure that people participating are giving their full and informed consent? And then here we have, in what situations may certain information be withheld from a patient while still achieving informed consent? Let's cut off that last section there. Then we have bioethics in the environment, incredibly important topic, sometimes not thought about as much, but bioethics in the environment is so important because what is bioethics but the ethics of biology? I mean, the environment certainly plays a pretty big role in that, so we need to consider animals, biodiversity, everything to do with the environment when it comes to ethics. So I'm just going to touch on it very briefly, just so you have an understanding, and so you can think about it, because bioethics certainly, or biology certainly does come up when it comes to synthetic biology and questions about how what we are creating will affect the environment. So first, we're going to ask ourselves, well, what do we owe animals and the ecosystems? That's what bioethics in the environment is really asking, and that's what environmental ethics is asking. What do animals have a right to? What kind of moral relevance do animals and ecosystems have? And how much, as people, do we owe them to keep them well and alive and safe? And how much do we balance the needs of human society versus the needs of the environment? So, of course, human needs are important and people are important, but how do we balance those needs versus those of the environment and animals and everything around us? And then we also talk about, do the needs of humans have more moral relevance than those of non-humans? So does my desire to eat, or does my need to eat and my desire to eat meat, is that more important than perhaps the desire of an animal to stay alive? These are questions that people have been asking for quite a while, and they continue to ask, and really it's talking about just the moral relevance of animals beyond humans. And finally, is there any intrinsic value in biodiversity, and what kind of intrinsic value in biodiversity? So what is the value of a beautiful tree aside from the benefits to the world that it brings? What is that value that is beyond the air that we breathe and beyond the food that it provides for other animals? Is there something valuable just in the beauty of the tree itself? Which sounds perhaps a little bit an odd statement to make, but it will make sense, I hope, in kind of this example. And again, similar to the last one, we're not going to go very deep into this, but I kind of wanted to give this example that has come up for me in some courses that I've taken, to give an idea of what some aspects of environmental ethics could look like when you get into things like ecosystems and biodiversity and things like that. So I'll read this out. We'll discuss it briefly, and then it'll kind of just be left there as something for you to think about. Suppose there is an area of land with two large hills that don't provide any known benefit to the environment around, but does provide some noted aesthetic value to those who see it. A company is looking to use the land for commercial purposes and will be removing the hills. Is there anything of value that will be lost from this project? If not, why? If yes, what would that be, and what is the value in keeping or losing it? So essentially with this, as you can probably gather, we're talking about the value of beauty in the environment, and we're just talking about the value of biodiversity in general, and thinking about is something lost? Is there something to be lost when we do lose kind of that part of nature that can't quite be explained by the things that it directly provides for us, aside from just the beauty of what surrounds us? And before I get a little bit too philosophical, I think we'll move on. But I did want to kind of touch on this part because I do think it is important. And like I said, we won't have a full discussion, but I wanted to kind of bring across those issues that are sometimes discussed, but that we don't necessarily think about them in our day-to-day lives, but they do definitely affect how our lives are run, how we live, and how we live as a whole. Now, of course, we need to talk about who and what is affected in any kind of bioethical issue. This is going to be something that is probably the most important thing that you will learn, because this stakeholders, which is what we're talking about, are so essential to bioethics, because we need to understand who stakeholders are, so who is being affected, what their needs are, and what we can do to help them. So we're going to do a little bit of that here. And this will really help you, I hope, understand what it means to consider stakeholders in any given case. So stakeholders in any given situation are those people, groups, or things that will be impacted by a particular course of action. So they are your mother who lives in a nursing home who has Alzheimer's. Okay, it is your dog who's a pit bull who's going to be affected by a citywide ban on pit bulls, or it's you, a stakeholder, who's going to be affected by the citywide ban on pit bulls as an owner of a pit bull. Okay, it's the indigenous communities who are affected by the government using their land. Okay, and by people living in Canada using their land. It's all these different communities, groups, people, animals that may be affected by whatever is project is going on, or by whatever course of action you're going to be helping people to make. Stakeholders are the most important consideration when you're starting a new project, 100%, because this is both where the issues lie and where the solutions lie. So if you are if you have a new drug that you want to test, such as the example we had prior when we were talking about considering the facts, well, you certainly need to consider who the stakeholders are, right? So if we go back to that example about a new drug that is meant to treat depression and anxiety, well, who would be affected by that? One stakeholder would certainly be people with severe anxiety and depression. So you need to consider, how is this going to affect them? What are the possible side effects for them? What alternatives could be considered? Everything that has to do with your project is going to be affected by who you are affecting through your work. Finding out who and what the stakeholders are will absolutely help you inform you of everything else, or a lot else of what you need to know when you're thinking about your project. Because when you know who the stakeholders are, you're going to, and what they need, you're going to be able to more clearly understand their needs. You're going to be able to more clearly understand your entire situation and all the possible issues you may come into as your project progresses. So I want to go through this little stakeholder exercise. We've got 2 examples here, and we'll do a couple examples of what some good answers would be after. And first, I just want you to read through these examples and determine what considerations are needed for each stakeholder that is mentioned. Okay, it's a pretty simple exercise. I only want you to read the examples and determine the considerations needed for each stakeholder mentioned. So what are the stakeholders concerned with? What is the possible extent of the impact to the individual and to those who are close to the individual? So what is the extent of the impact to the stakeholder and the potential impact to those who are close to the stakeholder? Okay, these are the things I want you to consider. Write down a few points and we will discuss them in the next slide. Here are some things that I would hope you might consider. You might have come up with some other answers. I'm trying not to go too long and trying to limit the number of slides that I devote to this. So it's okay if not all of yours are on here, or if you came up with some different ones, that's probably a good thing. But here are a few of the answers that you might want to think about when considering the stakeholders of the previous scenarios. So the first scenario with the treatment for drug addiction, or I think it was actually, my bad, I think it was just addictions more generally, but the stakeholders here would be people with addictions treated by this particular treatment. So they may not have the ability to complete the biweekly therapy, which is required. So that could be due to financial reasons. It could be due to inability to find a therapist or to get there, resources more generally. Are there any adverse side effects to this treatment that make it at all worse than other treatments or better? But perhaps side effects are not as important as if the treatment is so good. How long is the treatment plan? So if they have to do the therapy with the treatment, is it going to be a year, or is it going to be 6 months, or is it going to be 3 years, 5 years, or is it going to be 2 weeks? What treatment is actually being offered here, and how much does it cost? An important thing to consider always. People often forget about the cost, but cost is a huge barrier for many people. And then for the second example, we have the people that we're concerned with specifically here would be the people in the 60+ category who, but there would be other stakeholders in this situation, but these are the people that we are concerned with. And so these people may be especially concerned with not catching the virus or ending up in a hospital for another reason if they aren't going to have access to ventilators or to specific care. And they may be more reluctant to go to hospitals for fear of prejudice or lack of access to treatment. So all these kinds of fears could be drummed up by this particular policy. One thing that might be considered, are there loopholes in place for people who can pay? So are we allowing wealthier people to get access even though they fall into this specific category, and ultimately we find ourselves possibly with poor people or homeless people or less wealthy seniors unable to receive care when others who have more means can. And their family may be at further risk due to extra care, perhaps of not having these elderly people going to hospitals. Or nursing homes may be at further risk of harm due to this extra care because they won't be in the hospitals. So you will be perhaps surrounded by your family more and have to take care of them and exposed to whatever virus is at play here. I guess COVID-19 would be the one to think about here. And then added psychological stress. Just the added psychological stress of even being part of a group that is considered I don't want to say not worthy, because that is not the case, but a part of a group that is being excluded from care, that can add significant stress to someone, aside from the other stresses going on that everyone else has to deal with. This would be certainly something to consider. And again, you may have other points that you made, comment them if you want, or send them in to us if we've provided some way to keep in contact. Definitely send them in. I'm happy to hear, or just keep note of them. It's just always good to be thinking of different ways to consider stakeholders and what their concerns may be. Now that we've kind of gone into the other considerations to make, what we really want to start thinking about are the questions that we should be asking with each case given and with each project that we're starting. So what are these questions that we need to consider as we are thinking about the bioethical issues of any particular project or event or scenario? So first, you definitely want to think about what is the ethical question. Okay, what is the main question or questions that are being asked that of us? What is the moral dilemma or moral dilemmas? And then we want to think, of course, what are the relevant facts? You've got to get down the facts. You've got to know as much information as possible. You've got to think about what you don't know. You've got to keep note of it so you can help yourself later, which in turn, knowing the facts are really going to help you with your stakeholders. So who or what could be affected by the way the question gets resolved, or by the way that we look at this ethical issue? Who are the stakeholders? How are they going to be affected? Can this be a benefit? Is it going to be a benefit? Is it going to be a harm? Could it be both? What are ways to mitigate the harms and maximize the benefits? And then basically, what are all the relevant ethical considerations that we are making here? I mean, that is kind of a loaded question. There's a lot in there. It could mean a lot for a lot of different things. And the same goes for really all these kind of questions that you have. But we do want to look at what are the relevant ethical considerations that we can make, and how can these questions form your project. So what ethical considerations are you going to have to make, and what are you going to have to change about what you're going to do in when you're considering them, and how is that going to change your project? So all of these kind of go together, and you need to consider all of them, especially when you're considering any kind of scientific or synthetic biology project. So as we kind of move on from this lecture, I want you to think about perhaps a project you've worked on or wanted to work on, or something you've been involved in. How might you apply the principles of bioethics that we've learned today on a synthetic biology research project from start to finish? So next time we're going to talk a bit more about synthetic biology, and I want you to kind of be ready for that with these tools that we've talked about today. So think about a project and use some of the tools. Think about the facts. Use these questions that we've talked about. Think about the facts. Think about the stakeholders, who is involved, and what we can do to use those tools on a new type of project. And we'll hopefully be able to touch on that next time.